Here's what government looks like in Massachusetts, what municipal government looks like. And it's important from a public health point of view because not only do selectmen and city council have the ability to enact local laws relative to public health, but boards of health in Massachusetts also have that legal authority. So we have 351 municipalities that have the legal authority to adopt a local law specific to that municipality. And if you talk with any of the officials from any of those municipalities, they will tell you that they are all unique, which I'm sure we all feel in this room, that our county or our municipality is unique. So MAHB, my agency, is a not-for-profit association. We are funded mainly through grants from the Department of Public Health, and we provide technical assistance and legal education to these 351 boards of health and to other municipal officials within those cities and towns. When I was doing some research on for tobacco, which was how I started in this about 25 years ago, I came across this conference that happens yearly. I don't know if anyone's attended it. I have not. But it's called the Total Nicotine Conference. And in one of the plenaries, one of the speakers was speaking about adult use cannabis. And he was mentioning what we now know, that Big Tobacco was looking at this. This is huge for baby boomers. It's very well supported by the public, and that Big Tobacco was really looking at this, that they know how to grow, how to cultivate crops, and how to market adult products. I should say they know how to market them to kids as well as to adults. And we are also seeing now that cannabis is being looked at by Philip Morris has bought a large percentage of the cannabis establishment in Canada, and Coke is now looking at cannabis. So in Massachusetts, ours was done as a ballot question, which is not the best way to do it, and I'm really happy that New York is not looking at doing it that way, because the ballot question in Massachusetts basically was written by the industry, and it basically said, would you like to treat marijuana like we treat alcohol? And the vote was overwhelmingly positive. Although we call this recreational marijuana, we don't call alcohol recreational alcohol. So there's just that's just a little pet peeve that I have. When I think of recreation, I think about, I don't know, football, tennis, hiking. Yeah, I don't really think about marijuana as recreational. So I'm really happy in New York you've adopted adult use cannabis. So what happened with, we basically had a lousy ballot question, and luckily our legislature amended that ballot question in, I think, some very proactive public health sort of oriented ways, except they housed it at the Office of the Treasury instead of the Department of Public Health, but that's no longer an issue, it's there. So we have a Cannabis Control Commission that has 5 members, 4 of whom voted against legalizing adult use cannabis, which is interesting. The funding mechanism in our state is a 20% tax on the product. And I'm not going to go through that, but you will see at the end there's a community impact fee that I will talk about for a minute. The responsibilities of the Cannabis Control Commission are clearly ones that any commission would have. However, our advisory board, I think, really speaks to what the intent of this legislation was in Massachusetts. There is an expert in minority business development, in under-resourced communities, in impairment detection and evaluation, social justice, minority-owned businesses. There was clearly an attempt to be inclusive in this new enterprise in Massachusetts. Out of the fund also is a regulation fund, and again, it hits issues like jail diversion, workforce development, mentoring. I mean, the thought process, I think, is very rich and very proactive. There is also a research agenda that accompanies the legislation. And again, some of this has already been accomplished. We do have a baseline study now because we had medical marijuana in existence for so many years before we were able to create a baseline study on what marijuana use looks like. It's available for anyone on the Cannabis Control website. It's a public document, about 220 pages, of which I have not read. The fee structure here is also, you can see it's much smaller, it costs much less to cultivate and sell adult use marijuana than it does, or than it did medical marijuana. The annual registration fee for medical marijuana is exorbitant. For adult use, it's much, much more reasonable. Timeline you can't really see, but I can just tell you that the law was passed, I believe it was in 2016, and as of end of November 2018, we had 2 retail stores open. Some of the key sections in the regulation, we still do not have any establishments where you can use cannabis. We do have dispensaries. Dispensaries now have to set aside, they now can be co-user dispensaries, which is what we knew would happen. So every medical marijuana dispensary was set up to turn right into a co-used facility so they can sell both adult use and medical. But they do have to set aside a portion of their sales for their medical patients. That was a huge issue during all of the hearings, that medical patients were really concerned that once this took off, they would not be able to get their medicine. So we do have some conundrums that resulted from this law. We have host community agreements. And these are agreements that the industry or the establishment has to set up with the city or town before they can come into the city or town. And these, this impact fee is supposed to be no more than 3% of the gross sales. However, here's where we see big cannabis coming in and offering way more than 3% to cities or towns, which is putting small cannabis in a difficult situation. And this is the conundrum. The commission won't go into the content of those agreements. They just want to make sure one is signed. So as a result, we have some disparities happening in Massachusetts. Another conundrum is that we now have 2 separate definitions for marijuana accessories. We have one that call them legal marijuana accessories, and we have another that call them drug paraphernalia. The commission is aware of this conflict, but they have been silent on how we're supposed to treat this. So we don't have enough time to go into all of this, but this is one of my challenges, and I am suggesting that cities and towns can address this locally and limit the sale of marijuana accessories to adult use marijuana establishments and adult-only retail tobacco stores. Another conundrum that we have is that we ban the consumption of adult use cannabis in any public place. So what that basically means right now is that you can't smoke it outside. So you can only smoke it in your home or in your car, hopefully not when you're driving your car. But this presents a real issue for folks that don't own their own home or live in a single family home. Folks that are in public housing or in multi-unit dwellings are not able to consume cannabis, and it really is a social equity issue that we're trying to figure out how to address. Private clubs, we won't go through that, but unless you have a regulation to prohibit smoking in private clubs, that ends up being an issue in Massachusetts. Okay, I don't know why. It doesn't want that man to come up on the slide, but I didn't know who to replace him with yet, so he's still up there. And we don't know, quite frankly. I know for hemp, we have, that's been resolved, but adult use cannabis is still illegal on the federal level. Why do we care? Because it's largely a cash business now. It's very hard. You really need to proceed at your own risk. In Massachusetts, our U.S. attorney has said that he is going to be focusing on opioids, not on adult use cannabis, but we don't know what's going to happen in the future. So that is still an issue. And we have a lawsuit, you always have lawsuits, but we have one here because it's illegal federally. These neighbors are alleging that there's a violation of RICO. CBD, I am going to skip over because you have two speakers that are much more versed in this than I am. Local, and I'm going to skip over this too. Another issue that we have is the way our law is written. It says any edible products are not food in Massachusetts. The reason they say this is so that locals aren't forced to enforce the food code, the sanitary codes, those kinds of things in marijuana establishments. So if you're eating a brownie that has THC in it, you are not consuming food. I don't know what else you're consuming, but you're not consuming food. So that has presented a challenge to a lot of our local health departments. But there's a good reason for it. What they're saying is the state's going to enforce the food code, not locals. But it's really hard to say with a straight face that food isn't food, but that's what we have to do. So food isn't food. Here's how many applications we have in Massachusetts that are finalized, that are complete. Here's how many retail applications we have in Massachusetts for retail establishments. We currently have 9 retailers up and operating, 2 labs, 4 manufacturers, and 4 cultivators. You can't see this, but let me just tell you that the amount of money that is coming in via sales is, I can't read that either, we're up to 23,819 is coming in as of January 20th of 19. And you can get all of these on the Cannabis Control Commission's website. You will see that it is very lucrative. The first week, 20,400,000 was received from these retailers. So, and it goes up several hundred thousand every week. So the sales are substantial. What is not substantial is the amount of disadvantaged businesses that are actually submitting licenses. Right now, 85.6% are not disadvantaged businesses. They're all white guys, basically. And now when we look at licensing applications, we have the dispensaries have 130 pending. Again, the disadvantaged businesses, there are 4. So we're not doing such a great job there. And I don't think I'll go through local regulations because I've taken up too much time. So I'll stop there.